proactive medicine versus reactive medicine is really in some ways two different worlds. So the reactive model would be waiting till somebody is acutely miserable and then ending up in the ER and then treating them there. Well, that's a big problem. The reality is one of the biggest differences between the allopathic model and the functional medicine model is the belief that actually the human body is extremely intelligent. So really, the best doctor is actually the human body when it is coached properly and balanced properly. Reactive medicine is actually bankrupting America. It is estimated that Americans spend $300 billion on pharmaceutical drugs. $300 billion. Almost more than the rest of the world all combined. Just one country. And we're still ranked continually as one of the sickest populations in the developed world by the World Health Organization. So really, it's bankrupting our country financially and emotionally. And in fact, it's a big problem even with children now. About 50 to 52% of our kids, of American children, have some kind of disease diagnosis. They should actually be the healthiest. On the cellular level, kids should be the healthiest, but yet 50 to 52% have some disease diagnosis. We need to start looking at lifestyle, nutrition, thorough labs, and looking at treating cause of metabolic issues, cause of inflammation. And if we don't switch our medical model to treating cause, we're going to end up in the same ditch we're in now, which is massive debt, massive human suffering, and massive corporate profit. And that's where we're at right now. But it's changing. I mean, a lot of people do want to sort out a different medical model. The other very important thing to note is as people get above 50, we need to start looking at independent risk factor for stroke, heart attack, Alzheimer's and dementia. We need to start looking at people's individualized care and not do cookie cutter medicine. That's a really bad model. So if somebody has a risk factor based on family history or their own history, we need to start running individualized markers so that we can do preventive medicine for those individuals instead of waiting for a dire situation. Like how I explain to patients is waiting for the patient to fall in the ditch, then throw some dirt on them, and maybe we'll try to dig them out later. It's a really bad idea. It's very expensive. The most causes of bankruptcy in America above the age of 60 are medical expenses. That is the reason that there's so many bankruptcies due to medical expenses is because the conventional medicine model does not do, when it comes to internal medicine, does not do a lot of preventative care. Yes, colonoscopy and mammograms, those things, and pap smear is very important. But those things are looking often at structure, not the internal chemistry. So what we do here is very different. We want to take a detailed look at the chemistry of the body, of the individual.